right, folks, we're back again. Now we're looking at the inside of the heart. One thing you want to note when you're looking at the heart to kind of tell, when we look at this, we're gonna have, so if this is the front of the heart, when we open this up, these are the same chamber and these are the same chamber, so you kind of have to keep that in mind. So think of it like a book, so that you kind of keep that straight. Another way you can look at that is the ventricles have a much thicker wall than, or the left ventricles have a much thicker wall than the right ventricles. The right is pumping just to the lungs, that pulmonary circuit, so it doesn't have to pump very far, whereas the left side is pumping to, systemic is pumping to the whole body, so they have a really thick wall. So that helps you distinguish right from left when you're looking at the heart. So if we start here, on here, so this is our right side here, our left side here. So up here, this is the right atrium. All of the kind of ridging kind of texture that you see in the right atrium, that is going to be the pectinate muscles that are here in both the right atrium, and you can see it as well in the left atrium. So right atrium is here, pectinate muscles. As we come down, we're going to pass through the tricuspid valve. So if we kind of lift this up, you can see that valve there. So the valve is right here. Sometimes depending on which heart, this one you may be able to see it a little bit easier there. So you can kind of see that valve right here. So here's that tricuspid or mitral valve. What's attached to that valve, you'll see these white cords here. That's called the chordae tendineae, and they are attached to this kind of extension of muscle right here. That is the papillary muscle that you're seeing right here. So the papillary muscle is really nice and defined there. And then the chamber we're seeing down here is going to be the right ventricle. So the lower chambers are the ventricle, and this is the right side, so right ventricle. If we leave the ventricles, the right ventricle, we're going to go through the semilunar valve. So when we come up, oops, my little L. I have to turn them over here, sorry. So if we come back here, so this is the right side, this right here, these little flaps that we're seeing right here, these are the pulmonary semilunar valves right here, and there are 3 of them, but you're seeing 2 of the 3 there. So pulmonary semilunar valves, and that's going to take that out to that pulmonary circuit out to the lungs. When the blood comes back from the lungs, it's going to enter into the left atrium here. So we see the left atrium there. As you go into that left ventricle, the chamber right here, we're going to see that this is the bicuspid valve, and it's attached to the chordae tendineae. Still, you're going to see the papillary muscles that are here. We also can see that as we leave that left ventricle, we're going to pass through the aortic semilunar valves. I think this one shows it a little better on this side. Sometimes you get when you cut them in half. So here's our left ventricle, and here these are going to be our aortic semilunar valves here. So you can see 2 of those 3 valves right here. So that's the aortic semilunar valve. Then up here, these are once again the openings to those coronary vessels. So this is the right side, so opening of the right coronary artery. This is the left side, so opening of the left coronary artery right here, which was that circuit that we were seeing earlier. And one other thing that we can see in that right ventricle is the moderator band. So that you have this muscular piece of tissue here that kind of spans across the right ventricle, and that's going to be that moderator band. The other thing that we can kind of see, that the kind of texture or ribbing of the muscle in the ventricles, that is the trabeculae carne. So I think carne like meat, so trabeculae carne is that ridging that you're kind of seeing. Sometimes you see it more or less but it's always in the ventricles. Like I said, this is probably the best example right down here, but it's different than that papillary muscle.
Carne like carne asada.
Yeah.